Welcome to all of you for on episode 4 of FCN. We are a team of clinical psychologists. I am Dimple Panchal. I am RCA registered clinical psychologist, and I specialize in neurodevelopmental disorders. Ms. Debolina, we have here. She is also RCA registered clinical psychologist. She is a PhD scholar as well as a practicing clinical psychologist, and she specializes in emotional dysregulation and neurodevelopmental disorders. I hope I'm right, Debolina.
Yes, you
Yes.
are.
Yes. Then
Thank
we
you.
have Sheeta. She is again, I'd say, registered clinical psychologist, have her private practice as well as she's trauma informed therapist and peer affirmative therapist. Yes, we have Miss Lipika. She is RCA registered clinical psychologist. Even she's PhD scholar and she has a specialized area and anxiety, depression, and even diagnosis. So I hope I'm right for all of you. Yes, we'll go ahead and in the last session we try to understand how MPhil work and life in MPhil experiences of all of us. Today we wanted to go and understand more about therapy. Like what do we understand about therapy? What is the difference between therapy and counseling? So, Devalina, I wanted to take this question to you. What do you understand specifically about therapy, and how will you differentiate it from counseling?
Okay, so Dimple, if you see, I would like to give you a spectrum. So to make it easy for the viewers, so it is starting from guidance, then it comes counseling, then it goes to the psychotherapy. So the guidance is majorly focusing on here and now, and therapy it can go to then there. So guidance is very like just addressing the very superficial layer of the problem, whereas psychotherapy will take you to the very deeper roots of the problem. And psychotherapy, apart from guidance and counseling, psychotherapy has its principle lying on the psychological theories given by many researchers and many famous psychologists back. And we know, suppose a person who is following psychoanalysis. The theory goes back to Dr. Sigmund Freud. So similarly, a person who is practicing CBT is going to follow, suppose, the theories and the postulates laid by Dr. Dan Big. So this is how the guidance, counseling, and therapy differs. So now I'm removing the guidance part. Let us focus on counseling and psychotherapy. Counseling normally it is used very interchangeably that both are same thing. There is a confusion. Ki, who are you? You're a counselor. So we have to rectify. No, I'm a psychotherapist. No, no, you are a counselor. So we are all must have faced the same issue. And counselor, as I said, psychotherapy is also a type of counseling, but we are using the psychological principle. But whereas normal counseling, they might use, might not use. If they're using psychological principles, it becomes psychotherapy. Without the psychological principles, it will just remain a normal guidance kind of thing. So this is my understanding, my intake in a very layman term between counseling and psychotherapy. What my other teammates you think about it?
I think you're absolutely right in saying that it goes from guidance towards counseling, because everybody that gives guidance is not necessarily a psychologist, but everybody that gives counseling or psychotherapy has done some kind of certification. So you can have guidance, you can go to an astrologer, they can also guide you for your current problems. You can go to perhaps a career counselor and they will counsel you on what are the next immediate better steps to do. But when you go to a psychotherapist, when you go to a therapist, they have learned, they have structurally trained themselves in certain principles, and therefore with experience they know how to deal with problems. And like you correctly said, it does perhaps most likely take you to the deeper roots of your problems. So talking about where it comes from, where are these feelings stemming from, what kind of impact it has on your life. So it takes like an overall view of your past, your present, and your future also. Hmm.
I agree with both of you. Devlin has rightly pointed out, it starts from guidance, ends at therapy, psychotherapy. Another general difference is that counseling is for milder issues. So, not really for diagnosed disorders, but maybe for something like day to day stressors or some interpersonal problems. So, just for general milder issues. And counseling can be done for general population also. So general population in the sense that person is completely all right. There are no psychological disturbances. But perhaps let's say it's a child entering into adolescence. Adolescence is a difficult time. So now the child needs to be prepared that what challenges lie ahead. So for that also counseling is can be beneficial. So counseling is not just restricted for clinical cases or clinical disorders only. It's a general thing, like for milder cases or even for general public who are going through some life transitions. They can also use counseling. Whereas if you talk about psychotherapy, it's more for the clinical population or the diagnosed cases. For example, clinically diagnosed depression or anxiety, OCD, personality disorders, addiction disorders, and so on. So that's a general rule of thumb in which the audience can be aware about.
Yes, you all have rightly pointed out the difference between counseling and therapy. Now, our population would have this confusion. Should I go for therapy? Should I go for counseling? Can I get a counseling or not? So, according to all of you, who can go for counseling or who can go for therapy? Am I the right, like as Lipika has pointed out, that if a child from adolescence to adulthood, they are like say transition, can they go for therapy? Can they go for counseling? So would it be right for them, or because there is too much stigma lying around for mental health? So who would be the right people, who would be the right population going for counseling? Yes, they will.
I think everyone is eligible for a counseling, and if they think if they need psychotherapy for a specific cause, so they're also eligible. So I think whoever suppose a counselor who doesn't specializes in any form of psychotherapy, I will say specifically, suppose the client has visited because in India awareness is quite low. Because they will seek a psychologist and they will immediately visit that person without understanding difference between counseling psychotherapy. They might not know the non-psychology population. So it is the duty of the counselor to understand ki how deeper intervention this person might require, and if it goes beyond normal counseling or general counseling, it's the best practice will be to refer it to a trained psychotherapist. And vice versa, because sometimes the caseload goes so high, if a psychotherapist feels ki if it is this person doesn't require a very deep level of intervention, the psychotherapist can refer that person to a counselor. So this is how the referral network, I think we had discussed in the previous episodes, it should work within the system. Yep.
Yes, yes,
Yeah.
Devilita, you have rightly
Sita,
pointed.
Lipika, what you all think about this?
I think you're right. In the first, I think first to second episode of FCN, we had discussed the importance of a proper seamless system of referring, wherein every professional knows what they are skilled in, what they are trained in, what their competency, where their competencies lie, and taking a good account of that, being accountable for your client. You also refer your client to a practitioner whose expertise will suit the needs of the client. So I think you're absolutely right. It is too much for a person who's not from the psychology background to know who is the right person for them. So if every single mental health practitioner knows professional limits and knows what
Hmm.
applies where, who's a better suited practitioner for them, and they have a seamless system of references and a good network of other psychologists and other professionals, other mental health practitioners, then I think it is very easy for people to get the right kind of help.
Correct.
Yes,
Exactly.
like Devlina has pointed out. So if counseling, like she said, is for everybody. So no matter what stage of life you're in, no matter what is the age, no matter what circumstances, everyone can benefit from counseling. But for if we talk about psychotherapy, then obviously, like if you're diagnosed, maybe a psychiatrist refer for psychotherapy sometimes if they diagnose you with something, or if the clinical psychologists themselves diagnose you with any clinical disorder, then of course you have to go for psychotherapy. If the practitioner, if the mental health practitioner feels that it's a lighter case and doesn't require the intervention of psychotherapy, then yes, counseling can be a good option. So I think, like Shweta also pointed out, the professionals here have the responsibility to understand what is the professional boundary, what they can and cannot do professionally, and then accordingly they can refer the client or the patient to other professionals.
Yes.
that the client gets the correct amount of intervention that he or she wants.
Dimple, I would like to add one point here.
Yes,
Because
yes.
I had seen few cases, so they were having a normal life, no significant, nothing insignificant currently going on in their life. So they never had this uh, reason or need to go for a counseling or a psychotherapy. Now, the same people, once they have graduated and they have entered the workforce, now while working, they could actually find that there is some maladaptive behavior they have, and that is causing some issue in the working, like while working and so they normally what they will do, they will try to cope up while discussing with the colleagues, with peers and contemporaries. And eventually, if it is not getting resolved, then that time they might have the understanding, okay, maybe we can go for a psychotherapy or maybe counseling, whatever is suitable for the person. So it might look like a person might not have any issue, but different I will say the different stages in our life can trigger different problems, and we should always be ready and accepting that we might require help whenever the problem comes up.
Yes, yes, very rightly pointed out. Like when I may need a therapy, or I can talk it out with my friend, I can talk it out all the difficulties that I go with in my daily life. But sometimes it may overwhelm you. Sometimes your coping skills are being challenged, and at that time, if you are going ahead for a therapy, there is nothing wrong in that. Like as we have discussed in our last sessions that around like 10% of our population overall in India may need counseling overall in their life, okay, or may need therapy overall in their life. So there is nothing wrong. But our viewers also wanted to understand like what type of therapies are available. Are there any specific type of therapy which they would need, they can go for? So we want to discuss like is there one form of a therapy, or there are multiple type of a therapy that we apply the same thing for everyone, or is there a different? Yes, so what is your view on that?
Therapy is always tailor made. One recipe does not fit all candidates or everybody. So there are various types of therapies depending upon what your needs are. For example, if there is somebody that is struggling with raising a neurodivergent child, then there is a specific um, specific expert that can deal with a population such as that. If someone, for example, is surviving a very difficult marriage or is having a very different life change, there is a specific kind of help that you can receive on that end. So there are professionals. The point is that the professionals have to be specifically trained in what their inclinations are, and they need to excel more and more, and they need to get more and more certifications, not for the sake of certifications but for personal improvement, continuous education, so that they can give specific help for people like that. Another very important thing in this is that when you're training on something like that, you're naturally going to get trained by somebody who already knows about it. For instance, if you're learning how to deal with a person with let's say narcissistic personality, you're being taught by people who have worked in the field or who have done some sort of a research in that particular field. So you not only learn from the best, you also build a network of support. So therefore your chain of network sort of increases. So in case you have a client and you feel like you're having some sort of challenges, you can definitely use that resource to further refer them to somebody else. So this sort of continuous education not only helps the client but is also beneficial for the psychologist to develop a chain of network for themselves.
Right. I also wanted to add that, like Dimple has asked, that what are the therapies and what do we offer? So, for psychotherapy, we have evidence-based therapies that are available for specific disorders. For example, for depression, we have CBT. For anxiety, also there is CBT. There are other behavioral techniques that are available. So these are techniques that are developed. They have been researched, and a lot of lot of many years have gone by in their development validation. And they have the researchers have worked with different populations, different cultures, and after a lot of research, they have understood that okay, this is evidence-based therapy. So evidence-based really means that there have been RCTs that have been done with respect to that particular therapy and that specific population. So the psychotherapist or the clinical psychologist doesn't make up things on their own. They're following a proper set of instructions, a proper set of techniques that are there, and based on that, they give you therapy. So it's not some self-made things that they are telling you, or it's not some general wisdom or other jargons that they are telling. So it's like a specific thing that is there. And like Ashita said, it has to be tailor-made. So even if you are diagnosed with depression, I may be doing CBT with you, but it's not that I'll stick only with CBT. I might use techniques from other therapy also, or I might not go with CBT also. So I might take some other, completely another therapy, for example, interpersonal psychotherapy I may use, depending on what issues you're facing. So even if two patients are diagnosed with the same population, you cannot apply the same therapy to them based on their needs, their severity, and where the problem is coming from. You need to change your techniques. I need to change what therapy it is that you use.
So yes, Shrita, Deepika, all of you have told this thing right, that it is a tailored made. Okay, so we have to see the concern, whatever their current problems would be, and we will work on that. There will be some goals that will be made, and we will work on that. We'll merge. So it is not always a therapist's job to give away the therapy. A client will also participate, and client will also give their input. Do they like it? Do they like the procedure or not? Thus, we are talking about the procedure. What could be the process of therapy? Like in a general, what can we give away that how therapy looks like? Okay, according to you, and how like if a patient is coming or if a client is looking for a therapy, what should they know about therapy? Because there are too much material available on internet. Every like what is CBT, REBT, everything is available. So these are jargons for them. However, what would be the basic process that they can understand that therapy would be like this? Yes.
Okay. So to take on this, so the first thing I always suggest that when you come to a therapy session, come with an open mind. So don't come with, okay, I will go with CBT, I will go with REBT, I will go with DBT, and etc. etc. Because you have to trust the therapist, because the therapist will somehow will definitely know better, because the person has been trained in this field. And the therapy process, how normally it looks like the first time a client is visiting. And eventually the therapist is going to collect out the information, the background history and everything. And then normally they decide upon the goals. And based on the goals, now this is the collaborative process that pick up on agenda that what problem they want to address first. And while addressing that, then the therapist disclose, okay, I'm going to use this particular form of psychotherapy with you because I'm specifically focusing on psychotherapies only here. I'm not going with counseling or anything. So the therapist will inform the client, see this particular therapy I'm going to use because this is going to benefit you like this, with proper explanation and disclosure why exactly. Now, it is in the part of therapy. Occasionally, the therapist will give some read on material to the client to understand these things better. So, I think that is the good process. If both the parties are following, it will benefit both of them. So, eventually, otherwise, what happened? I have seen the process might hit the dead end. It is not progressing, and both the parties doesn't know why it is not working. So to have faith in the therapist and also have faith in the client is a mutual work collaborative process to make the therapy a success.
Yeah, drawing from what Debulina was saying, I think first of all, when you come into therapy, your agenda needs to be clear. Whether you want solution focused help or you want to work on some things, some patterns that you observe within yourself. Because if it is solution focused, of course, there is a module, complete module, which says solution focused psychotherapy. So that will deal on the problems in the here and now, and we will work through issues that you're experiencing in the real time. For instance, procrastination हो गया या फिर nail biting हो गया, something very specific that you want to deal with in the here and now. But let's say, for instance, you've dealt with a lot of problems in your life, and in the sense that you've observed that you have some kind of a some you become a different person around authority. You tend to people please, or you realize that you have a certain pattern, and if you want to work on that, then that's something, that's an invitation for the therapist to help the client pull out things that have sort of initiated that experience for them, or where it has come from. So then that means working from scratch. That means going back based on the client's
Hmm.
comfort, of course. But that would mean that you're working for something that, and that definitely the duration will also increase at that time. So when a client comes into therapy, the first motivation should be very clear as to what is it that they want to be helped in. So a common question that every therapist generally asks is, what brings you to therapy? So if the client knows the answer to this, if the client is aware about what is it that brought them to therapy in the first place, things get a little bit more clear and crystal for the practitioner. And then, of course, like Debelina said, it's a collaborative process. The client is not part of the therapy. The client is essentially riding the complete therapy, and the therapist is working in the sense that they are guiding them towards, and they're nudging them towards a particular thought line, or nudging them towards a particular way of thinking. So it's all you're all it's a complete collaborative process. It's not something that just because a therapist is in an authority position, they will decide on what works best. ऐसा नहीं है. It's collaborative. Ideally, therapists have to be collaborative in their approach. Yeah.
Right.
Yes.
I would just add on to what both of them have pointed, that it's a collaborative process and it's a voluntary process. So if the client themselves don't want to go for therapy, right, then nobody can really like force them into it. It's not like you take a pill forcefully and you get better. It's not like that. It's a completely voluntary process, and you have to be motivated for change. So the client has to have that in his mind that okay, I want to change. If that thought process is not there, that okay, I want to change, there's something is wrong with me, then therapy is not going to work. And another thing, like both of them have said, is it's a collaborative process. So the therapeutic relationship has to be built in the first place. That rapport has to be built. If that rapport is not built, then the therapy cannot progress. The first step will be to build the rapport. Here again, the client or the patient will have to trust the therapist foremost. If the client or the patient doesn't trust the therapist, then no change is going to take place. Because only if he trusts the therapist completely and he trusts the process, it's only then that the change is going to take place. And it's not like there's like a fixed like rigid pattern that we follow. It's not like that. Most cases it's semi-structured. It can be unstructured also, depending on what sort of therapy you're going for. But it's not like a rigid pattern. So it's not like when you go to medical professionals and they ask you a set of questions that what's your BP, what's your height, and so on. So it's not like that. The questions can be different, and again based on the client's comfort. So it's not like we are forcing the client to answer, you have to say something. It's not like that. If you don't want to speak about anything, that's completely all. So the client is going to decide the pace of therapy. What is it that he wants to speak about? What is it that he doesn't want to speak about? What is working for him? What is not working for him? Like Develin also said that you can give some reading material to the client, or there's some homework exercises that you give to the client. So there also the client will tell you, okay, this is something doable for me, this is not doable. So it's a collaborative process, and it goes exactly how the client wants it to go. A lot of times, clients and patients have this question in mind: oh, what happens in a therapy room? What happens in a therapy session? What do they do to us? So it's nothing. It goes like how you want it to go. You change sort of therapy in your way. You can take it where you want to take it. In most cases, again, it depends from therapist to therapist also. But that's what the general outline is.
Yes, yes, it is very nicely put by all of you. Therapy is like an alliance process where therapist and client work together for one goal that they have set. Yes, even we cannot force a therapy on a client. If they are ready, we'll go ahead. Yes. So one another thing that will come, which is very important in therapy, is a consent and ethics. So what do you think in like how consent play a role or how ethics play a role specifically in a therapy or in a counseling process?
APA has lined out some code of ethics which are mandatory for every mental health practitioner to follow. And one of the examples is consent. Consent basically means that the client is giving you permission to lead a therapy session or have work with them in their mental health concerns. And without consent, you can't do anything. For example, I can't pull my child and bring them to a therapist say कि इसको fix करो. I can't do that. So that sort of a consensual relationship or consensual therapeutic alliance need to be established. And consent is essentially the foundation of anybody, because Lipika a few minutes ago she mentioned something about rapport. So the a sense of rapport comes through consent. If you don't consent to this process, you're being forced into it. You're not going to be able to establish that rapport. You're not going to be able to open up to your therapist. So consent is essentially foundational. And then there are really important for clients to know is that whatever is spoken to the therapist remains within the therapist's office, remains within the therapist's cabin, and it is very well within their rights to uh, confidentiality in the things that they have spoken to. Like I said, drawing from the same example that I had given, just because I'm pulling my child into therapy and I'm bringing them to you, right to have that information that my child and the therapist have spoken, I can't know of that. So yeah, confidentiality and consent comes at the top of any ethics. And then APA is of course aligned other code of ethics, which are equally as important and must be followed by every mental health practitioner.
Right.
That
To
is
add on
true.
to what Shrita has said, there are other things like the therapist has to be non-judgmental, or they have to be unbiased, they have to be empathetic, they have to be patient, they have to be tolerant. So a lot of other things are also there. So basically, they are the foundations of therapy. They are the pillars of therapy. So if you don't have them, then obviously therapy is not going to be successful, and it's not really therapy if you don't practice these kinds of things. Like Shrita has mentioned, the confidentiality part. So yes, that is very much there. Whatever the client or the patient shares with the therapist, it remains confidential. There are certain expectations. There are certain exceptions to this where the clause of confidentiality can be broken. For instance, if the therapist feels that the client can do self harm, harm himself or harm somebody else, so in those cases, the therapist is obliged to report it to higher authorities. Or, for example, if they're working with any child and they feel that there is some abuse that is going on with the child, so those cases also they're obliged to inform this to somebody else. There are some exceptions, but generally the information remains confidential. Sometimes the information can also be shared with the treating team. So, for example, if you're somebody who is meeting more than one mental health professional, so if you're taking, let's say, medicines from a psychiatrist, therapy from a clinical psychologist, and you tell something to the clinical psychologist, and the person feels that this can be of help to the psychiatrist, then they can share it with your treating psychiatrist only. So your information can be shared with the treating team only if that particular person feels that there is a need to share that information. Otherwise, it all remains confidential.
Dimple, can I bring a question over here?
Yes, 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 sure.
So there's a very normal thing ki, what people say ki when we have friends and family, why do we, even we need to go to a therapist? I have two, three best friends with whom I can every day meet and share my problems. I went out. So that's enough. I don't need therapy. So what is this thing? So why do we actually need therapy? A proper therapist. Given the fact when we have our own best friends and family supportive, even supportive family, why still we need to go to a third person to sort things out?
It's a
One
wonderful
thing,
question.
yes, yes, yes. That
No,
question
no,
is
please,
very
Dimple, I'm curious to know. Yeah.
yes, yes. So one thing that I've seen, sometimes your caregivers are also overburdened by the information is putting like every day you are giving some or other thing, and they may come up with their own experience. One thing is that they may have their own understanding, own guidance, and they may also protect you. That they don't want to give you the real picture of you. Sometimes defend you. Okay, that okay you have done right and everything. However, therapists don't have that relation with you. Okay, therapist is not having that personal relationship with you, and they can see the whole viewpoint. They can have a different angle, and they can help you to process it out. So that's where we need a therapist, or we need a professional guidance instead of yes, you can get always you need a support system from your friends, family, and everything, but there is a line where your friends and everybody is giving you the best advice which is possible for them. However, you may need some time professionals help. Yes.
And more or less, when you're speaking to your friends, you also have to make some small talk. You also have to accommodate their version of the story, and it's natural in a flow of conversation. I will also, if I'm talking to a friend, I will also say, "Ki, "Oh, that thing happened with me also," you know. So there
Yes,
is there is this some sort of a back and forth. But when you're in a therapist's office, when you're having a therapy session for yourself, those 50 minutes are yours. You will not have to make small talk, or you will not have to create conversations, or you will not have to hear the side of whether the therapist also experienced
Mhm.
that. ये कुछ नहीं है. This is completely your space. And the fact that the wonderful thing over here is that the therapist is not your friend. So with a friend, you may feel like you need to censor certain information because they know me and what would they think of me. You don't have those those sort of you don't need to have those sort of filters with your therapist because you don't know them, they don't know you, you're not associated on a personal level anywhere. When this, that's not an engagement. So it is easier for the therapists, for the clients to open up to people that they don't know of, and it only helps
So,
because they are professionals, they're trained to help you in certain things. Yeah.
Yes, yes, yes. So, yes, if we talk about therapy, it will go along. But yes, therapy has overall many dimensions. We covered few of them. That is confidentiality, as Shrika and Deepika ma'am has rightly pointed out. That confidentiality is very important. We are not breaking or we are not bridging until and unless there is a case of like self harm or self harm to others. So yes, therapy, we also help you to understand what is difference between counseling and therapy, and at which stage or at which occasion maybe a therapist may help you or a professional may help you rather than the family members or the basic thing. If you ask about therapy or if you ask about your own problem to your friend, they may guide you, whereas therapist is not giving you a help. That is a basic understanding. They are not guiding you or they are not giving you the solution. There is no solution which is provided in therapy. You are coming up with your own answers. So that is basic understanding when we talk about therapy or counseling. So here we end us today's episode. However, we will take it ahead and we'll talk about the nuances of therapy in the coming session. Thank you, everyone, and to all the panelists today. Yes, for engaging session. Thank you.
Thank
Thank
you.
you.